The University of Florida Head and Neck Surgical Oncology and Microvascular Reconstructive Fellowship offers trainees a very robust experience in the gamut of head and neck surgical oncology and reconstructive surgery. And we provide training in the full breadth of head and neck surgical ablation, all mucosal tumors, oral cavity, oropharynx, larynx, sinonasal, skull base, as well as advanced thyroid malignancies, parathyroid surgery, transoral robotic surgery, as well as a wide array of reconstructive surgery, mainly focusing on microvascular free flap reconstruction, but also regional flaps and the entire reconstructive ladder.
There's a whole array of American Head and Neck Society fellowships to choose from, and one thing that really stood out here at the University of Florida was being the only fellow in the program. Was a big plus to me, but mainly their volume of free flap surgery, as well as variety as well, was very important. I'm only partway through my fellowship, but already my comfort level has dramatically increased with these complex cases. I feel, even compared to 3 months ago, where I stand today is leaps and bounds beyond where, and even farther than I thought I would be. And certainly my comfort level has gone up tremendously.
Our fellow will be primarily working with 4 main faculty. All of us have different backgrounds of training, so the fellow has an opportunity to learn many different ways to do the same procedure potentially. They can develop a wide variety of skills and then be able to mix and match those skills when they're done to develop their own techniques. So it's one of the advantages of working within our team. So our team dynamic is that our fellow is incorporated as a bit of a hybrid. They have attending privileges as well as trainee privileges. So in complicated cases that are beyond the scope of residency, they function as a trainee. And in cases that are within the scope of residency, we give them the opportunity to teach and train residents. And as the fellow becomes more experienced, as the year goes on, they gain more and more independence. Our goal is to train them to the point where when they graduate, they're as comfortable as they possibly can be to operate on their own and function on their own without a safety net. We like to incorporate the latest technology into our reconstructive armamentarium. For example, we do a lot of virtual surgical planning. So it's not uncommon for us to meet and with one of our computer engineers, look over upcoming cases, plan our surgical defects, plan our reconstruction. We also work closely with our oral surgery department in planning dental implants at the same time of surgery. And we find that using these three-dimensional models as well as cutting guides cuts down on surgical time, improves the accuracy of reconstruction, and overall improves our long-term functional and quality outcomes in these patients.
I moved here with my wife, and we've absolutely loved living here in Gainesville. We've felt it's been very warming, very welcoming. We've even had our first child was born here in Gainesville during the fellowship, and we couldn't have asked for more support. In terms of Gainesville itself, it's a very beautiful place to live. And there's so many things to do, and I haven't even gotten to the end of that list yet. But certainly in terms of restaurants or recreational activities, hiking and the scenery, you have it all packed into this one place, and it's just fantastic.